There is a revolution brewing. Whether you realize it or not, society is neck deep in the dehumanization revolution, and we're doing this wholly and willingly to ourselves. We're relying on a priority group of individuals to determine what is or is not acceptable human behavior. Morality is almost completely lost, and the difference between right and wrong, moral or immoral, can be boiled down to a right behavior, wrong behavior differentiation. And if you fall outside of the predetermined norm, look out, there's a cure for you. Carl Jung was once quoted as saying, "Show me a sane man and I will cure him for you." Well, society today has fallen both willingly and haphazardly into the lap of this very theory. And it's also funny to note, if you look up synonyms for the word cure on Google, the top rated ones are drug, elixir, medication, pharmacon, and placebo. Interesting. Well, this is Kaylee, and today we're going to be discussing some of the proposed revisions for the Diagnostic and Statistical Manual, version 5. So, for those of you that don't know, version 5 of the Diagnostic and Statistical Manual is due out in May of 2013. Now, the DSM is to psychiatrists what the Bible is for devout Christians. It is essentially the all-knowing book of answers for any potential problem or disorder that can be displayed by a patient. And what I want to do is I want to read to you an excerpt from the planning development that's on the website about the new DSM. The process for revising Diagnostic and Statistical Manual of Mental Disorders began with a brief discussion between Stephen Hyman, then director of the National Institute of Mental Health, Stephen Mirren, then director of the American Psychiatric Association, and David Kupfer, then chair of the American Psychiatric Association Committee on Psychiatric Diagnosis and Assessment at the National Institute of Mental Health in 1999. They believed it was important for the APA and the NIMH to work together on an agenda to expand the scientific basis for psychiatric diagnosis and classification. Under the joint sponsorship of the two organizations, an initial DSM-5 research planning conference was convened in 1999 to set research priorities. Participants included experts in family and twin studies, molecular genetics, basic and clinical neuroscience, cognitive and behavioral science, development through the lifespan, and disability. Now, to encourage thinking beyond the current DSM-4 framework, many participants closely involved in the development of the DSM-4 were not included at this conference. Through this process, participants recognized the need for a series of white papers that could guide future research and promote further discussion, covering overarching topics that cut across many psychiatric disorders. So essentially, a discussion between a few professionals, 3 to be exact, is what spurred the creation of what's going to be the foundation for research and dictation for mental disorder in the future. And it's also strange to note that the people who worked on the DSM-4 were left out of the planning process for the DSM-5. Well, that may be because they share the same ideas as Dr. Alan Francis, who was actually the director of developmental research on the DSM-4. And this is what he had to say about the new revisions. Impact on clinical practice. The DSM-5 drafts contain many proposed new diagnoses that will be very common in the general population. These suggestions, along with the drug company marketing that would undoubtedly accompany them, would create tens of millions of misidentified false positive patients who would then be subjected to unnecessary, expensive, and often quite harmful medication treatments. Interesting statement coming from someone who helped write one of the previous books. Well, I'll let you make your own decisions about that opinion. So before I get into some of the proposed revisions, what really is a mental disorder, as defined by the DSM? Well, this very definition is also up for proposed renewal. And let me read part of the criteria for you. Definition of a mental disorder. A proposed revision for the definition of a mental disorder is being addressed by select members. Features: a behavioral or psychological syndrome or pattern that occurs in an individual, the consequences of which are clinically significant distress or disability, behavior that reflects an underlying psychobiological dysfunction, other considerations. No definition perfectly specifies precise boundaries for the concept of either medical disorder or mental psychiatric disorder. Now, that's a very brief part of the definition and criteria for what a mental disorder is, but it's extremely important to note that there are no boundaries on these definitions. So essentially, anything in the spectrum of human behavior could be classified as a mental disorder. Please note that until April 20th, you can actually go to dsm5.org and see in entirety these proposed revisions that the so-called elite of the psychiatric community is going to use to define what is normal and what isn't when it comes to our sanity. Okay? So first, let's go to the section that's entitled Disorders Usually First Diagnosed in Infancy, Childhood, or Adolescence. These are the kids of America now being looked at. It's here that we find temper dysregulation disorder with dysphoria. This is a proposed revision. And this disorder is characterized by severe recurrent temper outbursts in response to common stressors. The temper outbursts are manifest verbally or behaviorally, such as in the form of verbal rages or physical aggression towards people or property. The responses are inconsistent with developmental level. The temper outbursts occur on average 3 or more times per week. The negative mood is observable by others. Chronological age is at least 6 years old. The onset is before 10 years old. And the behaviors do not occur exclusively during the course of a psychotic or mood disorder and are not accounted for by any other mental disorder. The symptoms are not due to the direct physiological effects of drug abuse or to a general medical or neurological condition. So, I don't have any kids, but I do have younger siblings, and I'm sure most of you know out there that children have a tendency to have temper tantrums when they're upset, to express their feelings. Well, now this is going to be classified as a mental disorder. I want to stay in the same section and go on to learning disabilities, which is also going to be a disorder. And yes, this is learning disabilities, which is a group of disorders characterized by difficulties in learning basic academic skills that are not consistent with a person's chronological age, educational opportunities, or intellectual abilities. Basic academic skills refer to current and fluent reading, writing, or arithmetic. So, if you have a child who's having some problems learning math, perhaps it's not their favorite subject, or, has some issues with English or reading, well, now that's a psychiatric disorder, which your local psychiatrist will be able to identify and prescribe, undoubtedly, a cure for. Now, I'm going to move away from adolescent and childhood disorders into just the generalized section where we find a new disorder called adjustment disorder. And this is the developmental of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months of the onset of the stressor. The stress-related disturbance does not meet the criteria for another specific mental disorder and is not merely an exacerbation of pre-existing mental disorder. The symptoms do not represent normal bereavement. Who classifies normal bereavement? Once the stressor or its consequences has terminated, the symptoms do not persist for more than an additional 6 months. Specify if with a depressed mood or with anxiety. So, if you come into a new situation or something happens in your life that's stressful, a divorce, a move, a death in the family, and you're having issues adjusting to it, to the situation in and of itself, even if it doesn't last for more than 6 months, this is now going to be a mental disturbance, a mental disorder that you should seek help and probably medication for in order to adjust properly. That's a little bit strange, and I would think a normal reaction to having something happen in your life that's stressful. And there's another disorder that I personally find kind of funny. It's number 300XX, factitious disorder on the self. And this is a pattern of falsification of physical or psychological signs or symptoms associated with identified deception. A pattern of presenting oneself to others as ill or impaired. The behavior is evident even in the absence of obvious external rewards. The behavior is not better accounted for by another mental disorder, such as delusional belief symptoms or acute psychosis. Now, to me, this definition is essentially, well, have you ever called into work sick when you're not really sick? I mean, you might be a little bit hungover or you just don't feel like going in that day. Or, you know, if you're in school still, you decide to skip school because you really just don't feel like it, but the excuse that you use is that you don't feel well. Well, that apparently is now a mental disorder. And there are numerous others on this website. I really encourage you to go look at some of them. I mean, there's olfactory reference syndrome, which is when you think you smell. You may or may not actually smell. You know, you could be out having done yard work for a few hours in the sun and you're hot and sweaty, or maybe you haven't showered for a day or two and you perceive that others think that you might smell. Now, whether or not that's actually true, it's a mental disorder. There's also post-traumatic stress disorder in preschool-aged children who may or may not have had something traumatic happen to them. And then there's another one which I find amusing, number 307.52, pica. And this is persistent eating of non-nutritive, non-food substances over a period of at least 1 month. So this is a child maybe that likes to stick different objects in their mouth. Well, now this also is a mental disorder. As I said, I don't have the time to go over all of the proposed revisions today, but they're mostly outlandish, and you do have the opportunity to view them until April the 20th of this year. You can also leave commentary on the website, and I encourage you to do as such. I'd also love to hear your opinions on what you heard in this video, so please leave me any comments that you have, rate the video, and don't forget to subscribe to Psyche Truth for up-to-date information. Thank you.